Nope, we're good to start.
Awesome. It looks like we have a wonderful group. Well, welcome all. Happy Friday. And welcome to this session of the 2022 Culture of Data Conference. And thank you all for joining us this morning. I know you have busy and there's a lot of things going on. My name is Ann Hill, she, her, and I will be moderating this session. And we're also really lucky to have Julia Simhai, also she, her, who is our tech support, and she's going to be managing the Zoom and making sure that the tech is running smoothly. Everyone is muted right now, but if you have any questions during the Q&A sessions, feel free to unmute. You can also use that chat box, wherever that might be on your particular computer, if you have any questions or need anything else. If you're comfortable in doing so, I had said this earlier, but please add your pronouns to your Zoom name. There's these three little dots that are close to your Zoom name and on your video square, and you can select that and then rename and add those pronouns. So we're really lucky today, and we have two presentations during this session, and each will be 20 minutes long with a 10-minute question and answer session piece, and then we'll have a 5-minute break after between those two sessions. And the theme of this particular session, which I've got to scroll back and forth on, this particular theme is macro to micro updates on the census and redesigning communities. And you can certainly think about how this relates to the overall theme of the Culture of Data Conference, which is recovery, resilience, and imagining new beginnings. So using data collection to really think through how communities, what's going on in communities, and how to tell a story through data. So our first presentation is named Census 2020 Findings for Colorado and What is Next. And it is going to be presented by Cindy DeGroen, and we're really excited to have her begin. Cindy, are you ready? Okay.
Yes, I am. Thank you. And thank you so much for having me. I've really enjoyed the conference thus far. I've been able to attend most of it, so it's fantastic. Let me go ahead and start my slides. If you want to give me a thumbs up if you can hear me and see the slide. Fantastic. So we're just going to jump right in. The big four takeaways that I have from today's presentation in terms of those primary population trends in Colorado is: number one, population's growing at a slowing rate. I occasionally give this presentation on places along the Front Range and they look at me and think, really? And so if you were outside of the Front Range, you would believe this, but concentrated growth, this is new. This is something we didn't see in decades prior. 95% of all growth in Colorado has landed along the Front Range. So that's why some of us along here who drive I-25 every day aren't really sure that the population's growth is slowing. The third trend, aging. Our fastest growing age group last decade was the population age 65 to 74. As we move forward next decade, as you guessed it, 75 to 84 is going to be our fastest growing age group. And certainly this impacts everything. So we're going to talk about it. And then increasing racial and ethnic diversity. Diversity in Colorado is highest for our youngest residents. And just as they continue to age, we're going to continue to become more diverse. So let's look at those numbers. The 2020 census population, US came in at just over 331 million. This was an increase of 7.4% since 2010. This was the slowest growing decade since the 1930s. If you've listened to the news in the last couple of weeks, the US, the growth rate for 2021, the slowest on record ever. So we're going to talk about why, but Colorado reached just under 5.8 million. An increase of 744,000 over the decade. This is about the same as we increased the decade prior, but a slower growth rate, 14.8%. So Colorado has tended to grow about twice the national rate, and we expect that to continue moving forward, but that ranked us sixth in terms of fastest percent change and then ninth in terms of growth behind some much bigger states like Texas, Florida, and California. But this was our slowest growing decade since the 1980s. So if we were to look at that growth on a map, the darkest colored states all having the highest growth rates. And you can see those are in the West and in the South. Colorado at the top of that second tier of states with our 14.8%. But then you may also notice there were 3 states that declined in population and are smaller in 2020 than in 2010. So if we look a little closer, more than half of all counties in the United States lost population between 2010 and 2020. And those 3 states with outright declines, West Virginia, Illinois, and Mississippi. But if we were to look at last year, 18 states were smaller than in 2020. And that included the entire Northeast region. And certainly the pandemic had an impact. But what's driving the slowing growth across the nation and in Colorado as well? It's really our natural change, what we call natural change. And it's births minus deaths. So if births are higher than deaths, we call that natural increase. And if deaths are higher than births, we call that natural decline. And as we're aging, this is going to continue to drive decline. So in 2017, 4 states had natural decline. By 2020, 8 states, and this is really a July number, so there was very little impact of the pandemic on that number. And I expected it to double by 2021, but due to the pandemic, we actually had 25 states that experienced natural decline. So that their deaths were all higher than their births, the tragic increase of deaths that we saw across the United States. To look at that on a map, all of the counties on this map in brown, smaller in 2020 than they were in 2010, so over 50%. And 86% of the population lived in a metro area by the end of the decade. So certainly we saw more growth like we did along the Front Range in metropolitan areas across the nation. And so that leads me to our next big trend, which is concentrated growth. So to look at the population change in Colorado by county, all of the counties on this map in red, orange, or yellow experiencing growth. All of the counties in blue or gray experiencing declines. And so we can just see how concentrated that growth was along the Front Range. And if we were to look, say, by age group, in terms of the number of children, the growth in children over the entire decade, 40% was in Weld County, one county, 40% of our kids growth. And so Weld is where Greeley is, for those of you maybe not so familiar. But then just to drive this point home a little bit more, I wanted to go ahead and chart every single county. So I don't intend you to be able to read those counties at the bottom, but this is all 64 counties in the state and then their growth. And you can see that that growth is dominated, not even just in the Front Range, but in 8 counties where we have it. And so I've thrown the names on the chart so that you can see that a little better. Denver having the largest change over the decade, followed by El Paso, Arapahoe, Adams, Weld, and then Douglas. In terms of population declines, the biggest decline was in Kit Carson County, which was actually related to, or in large part related to the closure of the prison. But then other losses included Logan, Los Animas, Bent, Conejos, Prowers, and so forth. But one of the things I like this chart for is to see the dramatic growth in, or the really concentrated growth in a few counties, but then also to note that most of our other counties, even those that experience decline, are more stable than they are having big declines. And that brings me to my next point, which is going to be aging. Now, age matters for many reasons. And when someone calls my office and says, I need the demographics for a certain place, age is always the place I start. It determines our preferences, right? Where we shop, what we buy. And this includes healthcare, housing, different type, how much housing is being demanded, type, size, how frequently do we move, the labor force. So the tight labor force, you may be working 2 jobs at the moment while you've got a colleague that whose position hasn't been filled yet. We know we have a tight labor market right now. Income, service demands. But before I dig into some of those, I thought it would be helpful to look at the age distribution of Colorado. So this chart starts at age 0 and goes just to age 90. And it's color coded by generation. And so hopefully you can find yourself somewhere on this chart. And if we look at the oldest generation on this chart, that's the silent generation. And these were the babies of World War II and the Depression, and there just weren't very many. And then they're followed in the purple by the baby boomers born 1946 to 1964, the first of whom turned 75 in 2020. And I've got a black line on this chart at 65. And so when I talk about aging, we're really talking about current Colorado residents having birthdays. That's what we're doing. And it's this much larger generation replacing what was a smaller generation within the state. And so we're in the middle of a very big transition in Colorado where we're going. So we were the 4th youngest state in 2010, but we're going to this place where we're going to look more like the nation by the end of this decade. And so we're halfway in terms of having a much higher share of our population 65 and over, but we're not there yet. So we've got half of it yet to go. And then I'm often asked the question, so we know we've got this large generation aging into older age groups. And so if we build this infrastructure, and then once the baby boomers age out of those age groups, what happens? And in Colorado, as you'll note in the green, those are our Generation X, or what were at first named the baby bust. We have almost the same level. And so we're not going to see a decline in the population within older age groups, but we won't see any additional growth. And then on the red in this chart, we see the millennials, currently the largest generation in the United States and in Colorado as well, followed by what's been the generations that have been named thus far, Gen Z and then Generation Alpha. But what does this mean for Colorado moving forward? If we were to think about the percent change in the population, we're expecting this next decade to grow by about 12%, which again is slower than what the almost 15% we grew last decade. The youth population expected to grow at about 1%. So that's a direct result of the lower level of births that we've seen in Colorado. Those entering the labor force and prime age workers, the 25 to 54 growing at about 15%. Now this number includes expected migrants to Colorado. So as we note, so the older age workers, let me talk about that. That one's 0. Again, that's the Gen X population aging into the age groups where the baby boomers were. And so we no longer see growth, but we don't expect any declines either. And then the retirement age at 19%, but then we see what I've called retired here, ages 75 to 84, growing at 68%. So absolutely the fastest growing age group within Colorado, and that is the entrance of the baby boomers into that age group where there was the silent generation. And so it's us, we're already here, we're just having birthdays. And then what I've called the long-term care, the 85 and over, the baby boomers aren't there yet. We're expecting a growth of about 49%. That's just that we are all getting to have more birthdays than previous generations. And so I don't want to not talk about aging and focus on the kids as well. So as I mentioned, the change in the under 18 population is another map where the red, brown, and pink are all increases in the population, and every state in the shade of blue experienced a decline. In that under 18 population, we declined by over 1 million last decade. 27 states have a smaller number of children today than they did in 2010. Colorado is not among them. So we did experience growth in our under 18 population, but this one's incredibly important when we, K through 12 has already experienced this, but the next group moving into higher education is one that's of particular focus right now because it's just going to be a smaller group moving in. But so what are the big implications from age and aging? Number one, as I mentioned before, that consumer demand. If we look at Colorado's growth by industry, last decade, our fastest growing industry, health services. There was a reason for that. It was because we had a large group moving into an age category that consumes health services. Our labor force, definitely older. We had seen increases in age of folks participating in the workforce at older age groups until the pandemic hit. And so we saw a massive reversal in that trend. We saw a significant number of retirements, which is part of why we have such a tight labor market right now. So the older adults not quite returning to the workforce to levels yet that they were in 2019, and for good reason. But then we also saw other folks who had caregiving responsibilities who had to leave the workforce. And so significant declines in female labor force participation rates as well. Then housing. Housing is tight right now. And so we've seen this extreme house price appreciation. Household sizes should be declining. given that we're aging and you end up with a smaller household size as you age, once your kids move out and find a new place. That didn't happen in Colorado last decade. We've got more people living in each house. I think we've got folks doubled up. We've got older adult kids living with family members. But when we think about our older age population, they're primarily owners. They own their home already. We have some impacts from remodeling and accessibility, but they're just not as likely to move. So if you think about the times in your life, perhaps when you made a big move, you were likely younger. And so we don't see that churn in the housing market that we've seen previously. So do we need more houses? Yes. And one of the reasons we need to think about that is we need to take into account also retirees aging that tend to age in place. So they're not leaving their home, but yet we need somebody to come in and take the job they had. And so they're going to need a new home. And so we've got this demand from new workers. Millennials aging into second home ownership. Believe it or not, 15% of all mortgages written in Colorado last year were for second homes. And so we've got some non-primary demand on our home ownership as well. Gen Z, they're the ones aging into housing and first-time home buying. And then we have to think about, the generation Alpha that's coming in after them, a much smaller young cohort, which is aging into adulthood, which is going to impact all of these as well. We've got a smaller number coming into the workforce as we have a much bigger number leaving the workforce. The other one I wanted to mention is becoming more diverse. So this chart is diversity by age in Colorado. It's an important point I think a lot of folks need to understand is that our youth population, the 0 to 17, much higher levels of diversity than we have in the 65 and over population currently. And so this one's showing Hispanic origin, American Indian, Asian Pacific Islander, and Black in terms of the share within the population. And the reason this chart isn't 2020 is because that data is not available yet, but it's coming. So if we were to look at, it's not available yet by age. And so what we did get from the 2020 census so far is the race and ethnic, how folks identify in terms of race. I can tell you in 2020, I think we have a better picture of what our population looked like than we had previously, but we also have a significant break in the time series. So I'm going to talk about that for a minute. So I mentioned earlier that Colorado's population grew by 744,000 over the last decade. We look 32% of those persons identified as white alone, non-Hispanic. About the same number, or 30.2%, identified as Hispanic or Latino origin. These can be of any race. The big difference between the 2010 census and the 2020 census is this 2 or more races total, those persons who identify as 2 or more races. So that was 20% or 1 out of every 5 Coloradans who responded to the census. But the growth in this 2 or more population includes growth in the 2 or more population, but the Census Bureau also significantly changed the way they processed responses to the census. And so I'm just going to tell you to use caution with any comparison in terms of these numbers, in particular for this 2 or more growth, 2 or more population. So when you're studying it, watch that difference. So what are the next steps with the census data? We got the redistricting data file, and we received that in August of 2021. That gave us our state counts and some of our race and ethnic distributions. But what's upcoming next, and I think it's going to be released at some point this summer, is what they call the demographic profiles. This is a subset of data that's coming from the demographic and housing characteristic file. So those of you who are familiar with census data, it was called the SF1 in 2010. It's being called the DHC for the 2020 data. And so it includes some of the variables listed here. And after that, we're going to get what they're calling the detailed DHC. I have question marks just because I don't think it'll be released until 2023. We don't have a really good idea as of yet. This one was more consistent, will be similar to the SF2 file, where we get more detail by race and ethnic groups. But I've also noted that this one's going to include complex person and household join tables. We've never had to talk about this with census data before. And the reason we need to talk about it is the Census Bureau has a new disclosure avoidance system. So we do want to keep folks' data private, but they have changed the way they're doing this. And so for the 2020 data, only the state total population and the number of living quarters will be reported as enumerated, which is very different. And so I'm not going to go through this information. I mainly want it as a takeaway for you, just that all data should be viewed critically prior to use. So thank you very much. And I'm happy to take any questions that you might have.
Wonderful. Thank you. That was absolutely wonderful, Cindy. We can open up the chat, or if you feel comfortable, you can unmute and ask your question.
Hi, this is Allison. Cindy, thanks for your presentation. I'm just wondering if I captured your point correctly about changes in housing size and baby boomers. And did you mean that housing size didn't decrease during the pandemic? And I guess I'm wondering if that's maybe potentially an advantage for people who are able to age in place, and if baby boomers are also more likely to maybe live in multi-generational homes right now. That also just seems like it could be a protective factor for health.
Thank you, Allison. That's an excellent question. And certainly what we had seen, so this is the first time in 100 years that household size did not decline. I'm going to start with that point. I think it's good and bad. And so I don't know if you've heard the term, I just heard it a few weeks ago, called boom mates. And so that is the baby boomer population who might be taking advantage of some roommates, which can certainly help in terms of isolation if you're going to age in place. There are a lot of advantages for young families as well, in terms of having, you've just got more of a support system built into that unit. And so I think there can be the good and the bad. One of the bad was COVID. It was hard if you had to work outside of the house and you also had, say, a grandparent living with you at the time and their exposure. And so, we've got a lot of, but it's a significant change. And so I think that's something that we're going to continue to look into. And I am very much so looking forward to the detailed DHC file. I think it's going to give us much more information in terms of what household structures look like now versus what they look like in the past. Did that answer your question?
While not a question, Kaylee was very thankful for the presentation, Cindy, and said it's helpful to see how much smaller the generation before the baby boomers was to get a real picture of the aging implications. And then another chat came in saying they also appreciated the data. Super easy to use and has lots of downloadable information. They've been talking about creating a demography public dashboard using that information. Their question is, any issues with local counties using that data for their own dashboard?
We would love it. So thank you very much. Absolutely, all of the information we put out there, I want people to steal, take it, make it your own, present it. Our goal is just to get it out there. The more people who repeat it, the more people who say it, we appreciate it. The other thing I would love, for anyone who's been to our website, that we've just done a major redo, we would love your feedback. And if you're looking for something and can't find it, call us, because most of our website gets developed when we get a question. And so we don't know what everybody needs to see, what would be most helpful. And so that feedback for us is invaluable. Just to reach out to me, say, hey, I would love to see this. And we'll try and get that information for you.
I also had a question, though, about this natural decline. It appears, based on your data, when we look at the number of the generation alpha, that this may continue. Is that correct? And what about the implications on that dependency ratio, like economics?
Excellent question. If there is one thing that keeps me up at night, it's that. It truly is. And so we have seen these significant declines in our fertility rates, in particular for our youngest mothers. And so one of the results, when we look, Colorado, if I take us back to 1990, 1 in 4 Colorado residents was a child. 25% of our population, just in 1990, was under the age of 18. As we move forward, that number's declined significantly. And so now we have about 1 in 10. But when we think about our workforce and our dependency ratio, right? It takes us 20 years to build a worker. They've got to be born, and then we put them through school, and then we get them trained, and we've just got this much smaller number coming in. The population in Colorado over age 65 will outnumber our population under age 18 in a few years. Nationally, I think we are thinking the population, and it depends on which source you look at, but several of the sources are starting to converge with the nation as a whole will start to decline after 2035. And so it is a result of that shifting age distribution. We'll be joining good company. We are one of the youngest countries of the developed countries. And so certainly when you look at a Japan, or you look at Europe, even the United States being one of the younger ones, we're just going to shift and no longer be one of the younger ones. But this one leads to such competing priorities, I think, for the state, because we've got this significant growth in our older adult population, but then each one of those kids is so important because we're absolutely going to need them in the workforce. And so this is going to be a tough time to set priorities.
I can only imagine how much planning is going to have to go into that. Yeah. Are there additional questions for Cindy? Okay, hearing none, thank you very, very much. We will take at least based on my clock, a 5-minute break. So reconvening in about 5 minutes, so at about 10:47, 10:48. Hopefully everyone else's clocks are congruent with mine. And so we'll look forward to seeing you. I'll put that in the chat though, so we all know. Thank you, and see you in about 5 minutes. Hi all, welcome back to our session. Our second presentation is titled Our Journey of Discovering, Uncovering Data to Information, Building Relationships in Longmont, Colorado to Create a Socio-technical Infrastructure. There are three presenters, Dawn, Nease, Kaylee Rivera-Gordon, and Dixon Dick, who will be presenting. I'm going to put myself on mute and Kaylee, you can take it away.
Thank you. Yeah, our presentation name is quite the mouthful, so you nailed it. I did want to mention that our other colleague, Dr. Bruno Sobral, is unable to make it today, but he is a big part of our work, and I just wanted to recognize him before we get started. So today we're going to talk on these 5 things. We want to let you know who we are and how this project came about. We're going to talk about how we've designed the system collaboratively, both with the city as well as community members and organizations in Longmont, and talk about what we've collectively accomplished to this point. And then we'll wrap it up, talk about our next steps, and hopefully engage in some questions with all of you. I won't go through all of these. These were just our learning objectives that we submitted with this presentation, but basically we were going to talk about our core issues of why this even came about, why in Longmont this was an issue and how we've helped to kind of mitigate some of the things that they've seen, and talk about the difference between data and communication and our approach, and then share our process for creating our community steering board. So we were actually able, and I say we loosely because I myself was not there in 2018, but Dawn and a few of our previous colleagues were able to present at this conference in 2018, right a couple years after the beginning of the work started. And the approach at the point of 2018 was really talking about the information silos that happen all across healthcare and social care, social services, and how people are seeking care, but every information is siloed and not shared and not being able to communicate about the person. And despite our shared goals of improving the health and well-being among all of these services, it's still a pretty isolated information exchange, and there continue to be barriers that exist among entities being able to share information. Go ahead, Dawn.
All right, thanks, Kaylee. So yeah, we, back in 2018 when we last presented, I think we were still in the mindset of thinking about how can we bridge gaps between these data silos, and I think that's not inconsistent with a lot of what's been going on in this space, particularly as I'm a family doc, and healthcare has been thinking about how to bring in social determinants of health into our thinking and our mindset as we try to address more holistically health and wellness issues. But, as we were thinking about this, as we were starting to work on this, we started thinking about, there's lots of data out there. One of my colleagues in the Department of Family Medicine at CU Anschutz like to talk about, that we're drowning in data, but we can't get a drink. I think that's definitely emblematic of kind of the situation that we're in. And so we started thinking about what if data and IT isn't really the core of the problem, and if it's not, if that's not the issue, what really is? And I will say that the other thing that really kind of helped us to focus was about 18 months ago, we got some funding from the city of Longmont. So we had to get real. We had to get down out of the theoretical clouds and actually get down to thinking about how are we actually going to make this thing work. So with that, we started thinking about this a little bit more deeply. So Kaylee, you can take us to the next slide. So Blind Man and the Elephant. I think we're all familiar with this illustration and this story, but in this particular context, trying to think about the elephant as being a person that's seeking help, particularly from the social sector. And I think that, oftentimes individuals' needs are complex. It's not just about one particular thing. It may not just be about food or housing. It's oftentimes multifactorial. And as somebody transitions from service agency to service agency, community-based organization, each of those organizations and the people that work in those have their own particular perspective on that person's needs by virtue of the services that they provide. So it's a little bit of a blind man and the elephant problem. But if you think about that and think about this picture, which I think is great, if we just integrate, if we just bring together all of these folks' observations, it's a spear, it's a fan, it's a snake, it's a tree, it's a wall, it's a rope. Well, if you just put all those together, does that equal elephant? Not really. So there's something more that's needed. And as we started to think about this, we started to think about, all data exists in context. And that context is really, really important, particularly when it comes to individuals. And understanding that context is more about just a specific data element itself. It's about having some conversation, having some communication around that. So that led us to thinking about communication. Next slide, Kaylee, thanks. So that led us to some more questions. Like, doesn't every expression or provision of care involve some sort of discussion between people? If I'm sitting down with a patient, I'm listening to the needs that they're expressing, and I'll have some questions of my own. We'll come to some agreement about what the issue is and how I might best be able to help. And those kinds of caring conversations, we like to call them, tend to happen over and over as people move from place to place in seeking care. And so we started to think about, what if an IT approach to develop infrastructure to solve fragmented care really became more about supporting these conversations and less about data integration? What would that look like? So that really forced a change in our thinking. It forced a change from, thinking about, this is just a data infrastructure, to thinking about human kinds of infrastructure, from fragmented data to human communication. And oftentimes, in these sorts of systems, they're housed in relational databases. And we started to think about, well, what about changing that to human relationships, and what kind of an IT infrastructure is that going to look like? And we sort of had to unlearn some things in order to relearn really how to approach this. And we had some help along the way, fortunately. We convened a community steering board. And these were Longmont residents that had lived experience actually seeking assistance from community agencies. And they just kind of helped us kind of blow up our thinking, and really helped us to go through many of the shifts that you saw on the previous slide. And where we've gotten to is a system, and this is where the big word socio-technical infrastructure, as opposed to just technical infrastructure, really is designed to shift power to individuals and to organizations. That really allows them to design and configure what we think of as their network of care, and adapt their access and use of that system to really meet their own needs. So it's really about kind of moving the power and the ability to kind of configure things down to the individual level, while recognizing that those individuals may at times need help with that configuration. So we've thought about that too. So again, when we were putting together this community steering board, we knew it was really important to bring in members with lived experience that had sought and received services. We wanted to get a diversity of folks. So, you know, sometimes it's easy to bring in sort of the usual suspects, you know, folks that generally tend to show up for these kinds of things. But we really tried to get more unusual folks, folks that, you know, might not necessarily usually show up for something like this. And I think we were successful at that, and that really helped us. So I'm going to transition now to Dixon, who's been our technology partner, who's going to describe to you a little bit about the architecture.
Hi, thank you very much. And so we really were motivated to get this done in a traditional way. You know, we started a project that many data practitioners would look at and say, I know exactly what to do. I'm going to pick a database. I'm going to, and then ... It's a very common pattern and we follow them. And that's our top diagram. But we ended up changing because we had these very difficult issues to solve that really they were incompatible with each other. And one of the hardest requirements to collect data was, how do you collect data from someone with no access to technology? They have humans that are assisting them, but we had to design a way that they could do that. We had to ask the question, how can we make it easy for people to understand that they could build their own networks of care? It sounds straightforward. It sounds like we're just going to create a way that people are going to access a portal or use the very familiar terms. But at the same time, we had to also make sure that information security requirements were met. And there were other requirements besides, but those three together make it extremely difficult. And to make a long story short, we ran up against the collecting data just didn't work. And so we, as Don has alluded to, we had to ask ourselves a different series of questions. And I'm going to transition you to the bottom diagram, which is instead of having the technology at the hub, what we're going to have is the human beings at the hub. So giving you a feel for that, what we're looking at here is the human middleware is now the human. So this smiley person down at the bottom is going to be really the center of our world. And what we're going to do is we're going to ask the architecture really to serve this person instead of having the person be served by. So this was a very different approach. So we created this notion of communities and branches, much like you have a community bank and then you have branches in different parts of it. We said using this information technology, what we were able to do was pull apart the problems so that we could isolate them and help create services for them for people who both served as human middleware and people who are residents who are looking to build networks of care. And the key element in all of this, which isn't really represented in the diagram, is this notion of a role. So really what's happening is, if you look at a role in the senior center, there will be a receptionist role, there will be an accounting role, there'll be a community services and a resource center role. For our center, which in Longmont is about food security, for our housing authority, which includes our Longmont Housing Authority, but also branches that include private. In between is one of them. Hope is another one. Each one of these has their own data, is now being captured in their own information secure way, where they're all basically following their own standards. And in this way, we decided to not integrate the data. I almost couldn't say it. You know, as data practitioners, you just have to do it. You said there has to be a way. And so we made the very difficult decision to say, we're not going to do it. But what instead we did was said, let's go to the communications and say, let's let the communications flow across the data. So that's kind of what I wanted to say about what we looked about this architecture. And so what we asked people to do is said, we are going to communicate between our human middleware, our residents, and these roles. And we're going to flow communications over databases where we pull and push into and out of the databases. That was the really interesting part about how we changed from and to. And so what we end up with when residents could say, well, let me configure my network of care, and we have this architecture, what we're looking for the outcome is we want to understand what are the natural pathways that are going to form. And it's the natural pathways of messaging. So we use this terminology that we're trying to, kind of invent, called a message of care over my network of care. So if I'm an individual, I'm a resident, I'm going to have my role in my own network of care is I'm going to have folks like my relatives, for example, important relatives. I'm going to have my practitioner, my doctor, and at the same time, I may reach out to the electric utility, because here we mean care, we don't necessarily mean healthcare. We mean all of those aspects of care. And that's where I am centric as a resident, but I'm also serving on the network of care for others. And so my role changes. And so I have multiple different roles. And so each of these sets of messages that flow through this network, through these networks of care, are starting to show shiny pathways, sort of like when you look at a college campus and you have the pathways that are all in concrete, but inevitably there's a dirt trail because for whatever reason, people are going to go take the shortest path between here and there. And then they come over and then they pave over it after it's been discovered where those pathways are. So that's where we wanted it. That's how we wanted to think about how the outcome was going to come. So this idea that we were looking for the natural pathways and the messages of care that flow across those pathways, that's what we were looking for to gain that knowledge. So having said all of that and put that architecture together, which was really a wrench, there's no denying that that was not a hard thing to do. It was very difficult to do. We got through that. We actually created it. We've done demonstrations of it. Most of this is stuff that people have never really seen before, the way we've put it together. The novelty is not the goal. We discovered that we simply couldn't do what we wanted to do using traditional approaches. And so the next step with this is we're going to go ahead and deploy this with the city of Longmont. We're going to work with our community steering board. We love these guys. They're absolutely incredibly influential, and make sure that as we actually get this lived experience, we're also going to get access to the community-based organizations in the city and work with all of them together to say, let's go ahead and make a trial of this architecture.
All right. I think that's all the material we had. Love to hear reactions or questions.
Yeah, so the Q&A portion then for this particular presentation is now open, and we would encourage everyone or anyone to unmute and or put your questions into the chat. While we're waiting, I did want to ask them, so it sounds like you guys you haven't piloted this particular this project yet, because I was wondering if there are any initial outcomes or impacts that you've seen.
Yeah, we're just on the threshold of our initial implementation. And so I think hopefully next year we can come back and share some of that. We've been fortunate that our first sort of tranche of funding came directly from the city of Longmont. Our next is coming through the city as well, but through ARPA dollars that are going to fund our work over this next year. So we're really excited about that.
Very cool.
So I have a question. Just wondering if you could talk a little bit more about how you're engaging with public safety and what kind of use case there is for them being a part of this infrastructure.
Yeah, which of us should take that? They've definitely been at the table. I think public safety, as you know, is one of those areas that actually pushed us a bit away from some of the data integration issues, because they have their own very strict privacy issues, requirements, that sort of thing. I think that one of the things that we heard early on is, even before we started building this, was that for public safety, there were issues that they were hoping we could help with essentially demand failure, where folks would call dispatch or 911, hey, I've got an issue, I've got a problem, and they would end up repeating those calls because they wouldn't get addressed. And one of the things that we didn't talk about, which I think is germane particular to public safety, but also some of the other groups, is that we developed this concept of information finding the people that it needs to go to. And so the concept here is that if somebody's reaching out for help, they may have an idea that, they need help with, let's say it is a public safety problem, but actually the best people to solve it may not be in public safety. And so as the groups are architecting these message of care and the care pathways, they have the ability to say, so for instance, public safety officer might say, for this particular problem, I want to make sure if somebody reaches out with this message, it also goes to these other people in these roles in other organizations. Because oftentimes it's actually not a public safety officer that's going to fix it. It's going to be somebody in Parks and Rec, or, you name it. So that was a really important piece for us to pick up on. Dixon or Kaylee, I don't know if you have anything to add to that.
Not directly, but the idea that the roles were the important things, that and that what's going to happen is that people are going to create these messages of care. We're going to give agency to everybody basically to go and create these, which is going to be very different, as opposed to, wait, I can create this message of care and I can decide it should go to these roles because it's going to suit me. It's a very leveling exercise, and it's going to be pretty wide open. And so, as Don said, we were triggered by this idea that we couldn't really serve the data monster, so to speak. And so we just leveled it all out and said, well, let's let everybody at the messaging and see what happens. So this is one of the outcomes that is unexpected about when we opened the gates to this sort of thing, is like, well, are we going to do this? And we all looked at each other and said, well, yes.
Yeah, and I think another kind of example to just piggyback on what you were saying there, both of you, with public safety maybe specifically, is perhaps there's a person experiencing homelessness and maybe they're living in their car and calls are being made perhaps to, oh, can you go and, they can't park here, or whatever the issue is, or this isn't allowed. Like Don was saying, this isn't necessarily something that public safety is then going to go solve or assist the person necessarily with. And so how can we open the door for there to be multiple people in the communications of this and allow that person to find resources and actually connect them to the services that are going to be most helpful to them. I think that example has come up a lot. And the one I love, which isn't necessarily public safety related, but could be other city services. If there is a person, maybe they didn't remove their snow from the sidewalk, and that's like supposed to be a fine. Well, that's going to the city to go, collect the debt on that, if you will. But perhaps what's really the case that's happening there is this person has not, they've injured themselves inside the house and they haven't been able to seek help and they can't get out to do that. Or, there's typically many other reasons that come into play for people to encounter different, issues along the way. And so how can we really start helping those deeper, real reasons behind the services being sought, if you will?
A two-part question came into the chat for y'all. The first part saying, in terms of what the underlying technology looks like, are your people contacts going to use a portal connected to the various data types? And the secondary portion of that question is, have you identified success parameters for your initial use of this structure?
No. So portal was one of the first approaches, and it didn't work out because the idea in the portal is that you're putting a lens on the data and you're fixing the questions, if you will. by breaking this apart into messages of care, we're really now, this is a great question, by the way, because now you might ask, well, where are those messages of care is going to be launched from? And so you're now able to put them at the point where they're needed. So, it's funny that even as we sit here, I can't tell you how many examples we used amongst all of ourselves, which I now cannot remember a single one, to give you as a case that says, isn't it obvious now that really what was happening was this person had a problem that looked like this, but the underlying cause was that. And now where's the point where you want it to come from? Now, at the same time, I will say, I don't know the answer. Should it show up on an app? Yes. Will it show up on multiple apps? Probably. Will it show up at points of contact as simple as, pushing a doorbell? A message of care can mean a lot of different things about a lot of different ways that you're basically triggering something that can create a message. A message of care doesn't mean I'm typing in a box with text. A message of care is a message. It's going to be a communication of some type that's going to hit a bunch of roles which are populated by people and managed. So kind of answering your first question, definitely not. This is going to be very exciting as we try to grab these messages and see how they're being presented. We're not really sure yet how we're going to field all those messages and specifically how they're going to go. We're very excited about that. This is very non-traditional, like we're saying, about how we're treating the data. That was the second part.
The second part was success parameters for your initial use of this structure.
I'm actually terrified of this question because having watched Cindy, present data in such a beautiful way, now I'm like, wow, what are we actually going to say? Look at these pathways. Now, I don't have the graphic, but what happened during the discussion when I tried to explain to everybody, I have two sons and they play games as they do. And one day I looked over the shoulder of my one son and I saw this very big spidery mandala looking thing with pathways all over it, with yellows and greens and reds. What is that? He said, well, this is my game called X. And I said, well, what is this telling you? He says, well, when a character goes here, it seems like when they get to this node, they can make a decision. And what these things are telling us is reds they tend to go in this direction. Yellows, they so much, oh, okay, so these are all pathways. So where did these pathways come from? Well, these pathways are generated during the game and ding, there you go. Somebody has already figured out how to represent this data in a super novel way that's gaming oriented. And we're going to go, steal, great artists don't borrow, they steal this paradigm of how do we represent the pathways that people tend to take when they reach these decision points. And again, this is going to be pretty difficult because most people of our age, notice the gray hair, and are going to say, well, sure, I was just gaming the other day. Well, we weren't, but yet, we're going to have populations of people who are going to immediately recognize, oh, that's me right there. I know it's about to happen. Now I can predict. Now I have forecasting power because if I'm looking at this and I'm looking at people who get into this particular part of the graph I want to say graph, but I don't want to say graph, but it's part of life or these pathways, these natural pathways that they're taking. Now we have forecasting power. So you can, I think, hopefully feel that from the data that we want to try to present it that way, which would be very non-traditional compared to, for example, Cindy's super clear way that she showed her data.
I also am quite intrigued because this is a very novel way of thinking about the social determinants of health. And I wonder if you all are, at least from where I'm from, we recognize we need to focus on those pieces. However, it is very hard to get consensus and collective impact. And I feel like you're going to be straight out pointing at these areas of need, right? Especially when you're talking about root causes. How are you going to convince people that they really need, or your leadership basically, that they are going to need to focus on these areas?
Well, I'll say one. I'll jump in here first. I think one thing that's been incredibly helpful for us is that our champion within the city of Longmont is the city manager, and I think he's Harold Dominguez is his name, and he's really had a vision that I mean, when we first started meeting with him and folks in the city, very quickly spun several stories of individuals that had complex multifactorial needs around social determinants and just really powerful stories. So I think we have a champion there in terms of giving us buy-in within the city and the city departments. One thing that we didn't mention, we talked a lot about this last time we presented 4 years ago, but we've also had a series of convenings, conversations with the collective group of community-based organizations in the geographic area of Longmont. And that's also been a process of developing that buy-in and understanding about the approach that we're taking. So we're hopeful that once we throw open the doors to this thing, there will be folks who will, as there always are, there will be early adopters. But there will also be folks who begin to see that for their particular organization that's trying to serve folks with these needs, that it's actually, if they're not participating, they're missing out.
Yeah, there's a FOMO to this.
Yeah, and I would just add, there's been a lot of work to engage folks, and that's important to note that, Dawn's talking about 4 years ago presenting, and the project even before that started 2 years prior. So it takes a long time, but it's worth it, and it's going to have a huge impact. And that's what community engagement is. You build these relationships and you maintain them. And hopefully our work with this community steering board has, the opposite of maybe leaders, but in organizations, but we're working with the grassroots, the people, the real individuals on the ground who would be accessing services and want some of this support. So if we can come at it from both angles, hopefully then there's a symphony and it all comes together and people buy in across the board.
Thank you all. We have about 10 minutes left before this session ends. So I did want to open it up where we can ask either of the presenting groups to answer any additional questions. Additionally, I believe, Allison, all of these presentations are on Sched. So if you wanted to download them, they are available there. I know that had been a question yesterday that I've seen quite often. So are there additional questions for both of our groups?
I had a question. My name is Jeff Korn. I'm with Eagle County Public Health, and it was really sort of, have you had a conversation or kind of feedback from city staff? Because you're sort of adding another communication sort of tool, and so is this going to replace existing communication tools, or is it sort of going to sort of sit on top of those? And is there a perception of that potentially being extra work for folks to just sort of practically manage this other layer of communications?
I have to jump in with my colleagues just waiting for me to answer this one. So there was very much a strong reaction to not provide another way, another thing to learn. And that's where, totally back to that answer that I gave, which is let's not create another portal. That was a very strong message. Now, but the question then is on your mind is, okay, what did you do? Well, so what we did was we said, what control surfaces do you already have that you already use that we can take advantage of, we can leverage? That was the first thing. So where everybody uses, for example, a Microsoft SharePoint, or they'll use shared folders, or they'll use, they already have tools, generally speaking. That's what we're going to address. That's the first thing. The second thing, however, is that we're going to address process power. But what I mean by that is where's the workflow in this? And can you automate that for me? And so we observed, for example, in one particular city, as I walked in the door with a gentleman we were going to have a meeting with, he was taken aside, but said, excuse me, I have to talk to someone. And we watched this negotiation occur between the two of them. Somebody wanted a permit to do something, for example, hold an outdoor concert, and they negotiated And that one act, absolutely, negotiation is one of the key things that we've learned is what makes a smart city. And I hate to go down the smart city pathway. Let's not go do that. But this idea that you're capturing knowledge in a negotiation, it became the question of what is the control surface that allows us to have people use these messages of care to create and capture negotiations amongst multiple roles. So part of the answer to your question is we have to absolutely avoid creating a new tool at all costs. You know, there will be the need for it somewhere. You got to log in, you know, you have to create something. But as meaningfully as possible, we want to integrate it with the workflows that they already have using the tools that they already have. And there is still something yet to be determined about how we do that. I hope that was a helpful answer.
Yes, thanks. Appreciate it.
Oh, there's another question in the chat. So a question for Cindy. Oh, Allison, you could even read this.
Yeah, sure. I guess I was just wondering if you could comment kind of on the newer census data releases and if you have more confidence in them than like earlier versions, which were just found to be unreliable.
Thank you so much for that question, Allison. Not at the moment. So I am very concerned with, and my last two slides, if you end up downloading them, they don't use block data. That's hard. That's hard for me to say because the census has always been the gold standard in terms of the small area data. But with this new disclosure avoidance system, we had to make some trade-offs, right, between privacy and accuracy. And so one of those trade-offs is that block data will absolutely need to be aggregated. When we think about slicing and dicing the population, you know, we are working with the Census Bureau and we are advocates for data users. And so we're trying to be as loud as we can in terms of saying we need more accuracy within the data. But the most recent, let me back up one step because every one of us can go take a look. They are releasing demonstration data. And that demonstration data was just released a couple weeks ago for both the population and the housing unit variables. And they're releasing data for 2010. So we have what was published in 2010 using older disclosure avoidance system, and then would be published today for 2010 using this new system. And I can tell you, I've been living in it the last couple of weeks, of course, and we have blocks with only toddlers. We have blocks with people in no occupied housing units. And so part of what's happening with the data is they've separated the people from the housing unit. And so they add noise to each independently and then try and add them together. And that's not working. And so with the DDHC file that's going to be released, they're going to put the people in the housing units and then they'll add noise to the data. And so if you're dealing with any data where it's people in housing units, don't use the DHC. If you're just looking at the people file or you're just looking at the housing unit file, it'd be fine. So we're going to have to learn, you know, we learned with the ACS, we have to pay attention to margins of error, right? So this is going to be the first census where we wish they would put some kind of margin of error, but statistically we don't have those because it's just the noise that's been added. And so the Census Bureau is going to be releasing metrics. At the moment, I'm not happy with their metrics because it's an average of everything. And we all know that we're never looking at the average. We're looking at one of the tails, right? We're looking at the end when we want to dig into the data. And so we're doing some extensive research into best practices for use with the Census 2020 data. I would say our number one thing is to look at it critically. So if you go and you pull the data and you want to use it as a denominator for something and it looks surprising or weird, it probably is. And so one of my biggest recommendations at the moment for folks who are going to use it is to go up a geographic level. You know, if you're looking at place data, then jump up to the county really quick and take a look at what that data looks like and how is this place different than the county and does that make sense to me? Does that seem realistic? And so we're still putting on a lot of pressure. This first release, they underrepresented all young adults and they overrepresented all older adults. And we know that happened in the census count as well. But then it went even further once they added the privacy protection. And so there's going to be one more round. We're providing a significant amount of feedback to the Bureau, and they're going to try and fix what some of the issues are. Because some of it is the post-processing of the data. So they've added the noise, but then they don't want to release negative people. And so they have to adjust all the people back up to make them positive. And so we have a lot of room to work, I think. I think they have a lot of room for improvement. And I think they're working on that improvement. And so this next round that they release will be closer to what will actually be released. And so just stay tuned. We're going to release a lot of guidance on our website. But certainly I would say use it with caution.
That was super helpful because I use that data all the time. Thank you, Cindy. So we're just about a minute before time. I want to thank you all for attending this session and for also engaging in the question and answer period. I have a few short announcements before everyone sort of jumps over to the walk and learn. So as I noted beforehand, the slides are available on Sketch. Additionally, there is an evaluation that you'll be getting by email after the conference is over, and please fill it out, even if you've only attended a portion of these sessions, because it really does help with planning and for the planning committee. There additionally will be an incentive, obviously, so you can be put into a raffle and possibly win one of two $50 Amazon gift cards. And as many of you know, that this is the last live session for the conference, but the content is not done. There is a walk and talk session available for you to listen, and it's called Words Matter: How What You Say and Don't Say Influences Well-Being. And after that, the conference will be officially done. So we also encourage you, if you really enjoyed this Culture of Data conference, that you check out Public Health in the Rockies, which is also a fantastic event hosted by the Colorado Public Health Association each year. And you can go to publichealthintherockies.org to check it out. We also want to thank you for supporting Colorado Public Health Association, or CPHA, and joining us for these sessions. Excellent job to all the planning committee. Thank you all.